Good afternoon, everyone. It is a pleasure for you all to be here with us. I was now telling someone that we have had 40 registered persons and Trini to the bone. And we know we don't have all Trinis in our space, but we want to start. We're already 15 minutes in. I am Placide, and I want to welcome you to Safe Place Family Life Enrichment Center. Our workshop today is the silent epidemic anxiety. Anybody anxious this evening? Just drop it in the chat if you feel a bit anxious this afternoon. So thank you for being here. Thank you for sharing this time with us. Let me know if you're hearing me in the chat. Somebody can let me know if you're hearing me properly. So let's get started this evening. We have a power-packed session for you, and we hope that you are taking notes. Thank you so much. Excellent. We hope that you are taking notes. We want to welcome you again, and just a bit of housekeeping. Keep your microphones on mute unless you want to speak, and you can use the emojis or the hand raising thing there that's afforded for you on the virtual space. Feel free to put your cameras on if you're most comfortable with that. It's quite fine. Just be mindful of your background. The call will be recorded, as you just heard, so feel free to change your name if you don't want to be identified for your privacy. And if perchance while we are chatting, and it's a conversation this evening, you are feeling a bit triggered, please use the private chat and you can communicate with myself, Placide. You also have Rachel on, and you can communicate with Andrea. Be mindful to keep your mics on muted. And I know my co-host will assist me with that by muting others. And feel free to put your questions in the chat. Some of you would have sent in your question already, and we do appreciate that. So who's excited this evening? So a little bit about Safe Place. At Safe Place, we empower our clients to live a better life by exploring and connecting with what really matters. We help you move beyond survival to a life where you thrive in a haven of emotional health and positive life transformation. Hence the reason we are having this session this evening to talk about what really matters to us, because what we know is that life isn't always easy. Sometimes even the strongest persons have difficulties in working through and navigating life. So we are here to provide you with the tools to help you navigate life. I just want to put a disclaimer out. This is not so that Safe Place can get clients. This is to help you navigate life in a positive and a healthy way. So once again, I want to say thank you so much for sharing your afternoon with us. So as we get started, which emoji best describe your current state of mind? So use the chat, and I'm looking forward to seeing some emojis going there. Just be some good audience with us this evening. Which emoji best describes your current state of mind this evening? We're not sure what has happened this morning, what is happening with you now. So please drop an emoji in the chat. And we're waiting. I dropped mine because I'm very happy this evening. Anybody else? Thank you, Shelley. Let's keep it going. Colleen, thank you so much. Yes, thank you so much. Just let us know what's your current state of mind. So by guessing, I'm seeing some happy faces. I'm seeing some calm faces. We're still waiting on some others to join in on this temperature check this evening. How are you feeling? And for those of you all who can't find your emojis, just drop it in the chat. You can put ready, you can put happy, you can just let us know what's happening with you this afternoon. Thank you so much. So as we begin our session this evening, and we are going to get straight into this evening's discussion, that's why we are here. And so we want you to take notes. We want you to be mindful of what's happening with us in this space. It's a safe space. And so we want you to be able to be brave enough to share your experience when we ask of you. Feel free to private message if you have questions and you would like it to be asked. This evening, we have first up Ms. Andrea Baksh, who's currently the resident mental health advocate at Safe Place Family Life Enrichment Center. Having immersed herself in the field of psychology over the past 12 years, Ms. Baksh is making strides in the mental health field by impacting lives, transforming minds, and healing hearts. I love that. She spent a number of years as a guidance counselor in the education system before entering the corporate arena. Andrea is constantly pursuing further education in the field of psychology, currently niching in the area of marriage and family therapy. Her academic accolades are in the areas of psychology, criminology, and criminal justice, Christian counseling, grief and loss, and crisis intervention. In her spare time, outside of all of this, she enjoys reading books, listening to podcasts, and spending quality time with her friends. Her personal calling statement is to provide clarity, impact, motivate, and serve the lives of others. Ladies and gentlemen, put your electronic hands together, your virtual hands together as we welcome Safe Place Family Life Enrichment Center mental health advocate, Andrea, to the stage.
Hi, good day, everyone. I'm about to share my screen with you so we could have a little bit of fun. Okay, so today I am here to talk to you about the silent epidemic anxiety. So you're probably wondering why we choose anxiety, why there are myriad topics, issues, problems, concerns within the mental health field that you could cover and a range of things. However, we choose anxiety. Now, I have a little bit of a proclivity for data. So before this topic was chosen, we would have done a survey. Some of you may have gotten the survey, some may have not. However, anxiety was actually the #1 topic chosen when persons were asked to identify mental health topics that they wanted more information on. Many people, one, experience anxiety, two, know someone who experienced anxiety, and three, had many questions when it came to anxiety. So we decided, what is the best way to deliver the highest level of value to persons who are just out here with more questions than answers? And that's how we curated and developed this session today to deliver just that for you. So you're going to have to bear with me today. So this is our agenda. I personally will be taking you through the definitions of anxiety. We're going to look at anxiety and the brain, the triggers and risk factors, and just some statistics on anxiety and how it affects us. Now, so what is anxiety? So I decided, now there are our academic definitions for anxiety, but there's also what we know from what we experience. So I decided, here what, I'm going to give anxiety a voice. So I decided I'm going to ask some people what is anxiety to them. And these were some of the answers that I got. So Terry C said that anxiety is, for her, is like not having control of your thoughts. Ellen D said it was like living life trying to manage your fears. Precious I said it's being fearful of being fearful, and I like this one. Kimberly D said it was like waking up every day and fighting not to be consumed by negative thoughts and overthinking. And I didn't want to be left out, so I asked myself, And I said, for me, it's an uncontrollable nervous feeling that I feel in my entire body when I feel anxious. So this is the academic definition of anxiety by the American Psychological Association. It is an emotion characterized by tension, worried thoughts, physical changes like increased blood pressure. And the thing about it is people with anxiety disorders usually have recurring intrusive thoughts or concerns. They might avoid certain situations or places out of worry, and they might have physical symptoms such as sweating or trembling or dizziness or rapid heart rate. Now, anxiety could sound a lot like fear, and based on what a lot of persons would have said in their explanation of what anxiety is to them, the word fear came up consistently. And it was then that I realized that anxiety and fear can sometimes be used interchangeably, the terms. However, anxiety is not the same as fear, but like I said, people often use them interchangeably. Anxiety is actually considered a future-oriented, long-lasting response, broadly focused on a diffuse threat, whereas fear is an appropriate, present-oriented, and short-lived response to a clearly identifiable and specific threat. So if we were to translate that to our lived experience, fear, a snake. Simple example, a snake, we feel fear. It's a present and imminent danger. Whereas anxiety, it's worrying about a possible future scenario, situation that could happen, and then thinking about that causes us to feel anxious, right? So now it's often said that anxiety happens in the mind, or sometimes have you ever heard somebody tell you it's all in your head, or just stop thinking about it, or it's anxiety. I've even heard one person say that anxiety is imaginary. So the thing about that, statements like those, they can serve to invalidate your experience with anxiety. So it could sometimes make you feel like, one, you're crazy, or what you're experiencing is not real. So I am here to tell you and to show you that what you are experiencing with anxiety is most definitely real and you are not crazy. So in the academic sphere, there is a debate about whether the mind and the brain is two separate things or the same things. Now, some people debate the mind and the brain is the same thing. Some people saying it's different, two separate things. Now, in reality, the mind is related to the brain. So most scientists and thinkers believe that the mind and the brain is one and cannot be separated. Most of the time, these two words are used interchangeably. So sometimes people could say in my mind, and it's speaking about the brain, or in my brain, and they're speaking about their mind. While the brain is actually a physical organ, but the mind is mental. We can see and touch the brain, whereas it's not possible to actually touch your mind, right? But how does this all relate to anxiety? The truth is, we experience anxiety both in the brain and in our mind with our mental processes. Let me show you how. So, this is the science of anxiety. So, when you have an anxious response, three parts of your brain is involved. The first is your brain stem, or what we call the survival brain. This is with your animal brain or your reptilian brain. Then you have the limbic system, which is the emotional brain. So that's your hypothalamus, your hippocampus, and your amygdala, right? And then you have your frontal lobe. So this is what we call the smart brain, the thinking brain, or the neocortex. Why are these three important? So your survival brain is actually responsible for keeping you alive. It does control things like your heart rate, your breathing, your body temperature, your sleep or wake cycle, and your movement. And if you think about it, when you're feeling anxious, these are some of the areas that get affected. Now, your emotional brain is responsible for regulating your emotions or how you feel. And your smart brain is responsible for higher functioning and deep thinking. It is control stuff like your communication, processing, reading, writing, talking, and listening. It's responsible for critical thinking and problem solving. So now I'm going to show you what happens with the brain when you actually experience anxiety. So anxiety happens when part of the brain called the amygdala, which is right down here, experiences or senses trouble. So it's like an alert system. The amygdala goes live when you feel anxious. When it senses a threat, whether it's real or imagined, it surges the body with hormones. So it starts to let out hormones one time, including cortisol and the stress hormone, right? And adrenaline to make the body strong, fast, and powerful. So this is what we call, and you would hear this term, the fight or flight response, right? And that is what has been keeping us alive. And this is what our brains are supposed to do. Healthy brains are supposed to release those hormones when there's a threat. So basically, an anxious brain is a healthy brain. It's just being overprotective. It is more likely to, when it senses a threat, it will hit the panic button just in case. The amygdala is like, I'm not sure if it's real, but I'm just going to hit this panic button because this is what we're about to do. We're not going to go through this, right? But one of the awful things about anxiety is that the way it launches the warning, and often without need. So what that does, if there isn't an imminent threat, it sends the unsuspecting body into fight or flight. So there may not be an imminent danger or threat in front of you, but because the amygdala sent that message to your body responds in kind. So the fight or flight does happen automatically and instantaneously. So neurochemicals will start surging through your body and priming it for the fight or flight. So basically, the brain is made up of two hemispheres, the right and the left. The two sides are actually connected, right? And by a bundle of fibers here, we call it the corpus callosum, right in the middle here. So communication between the right and the left sides happening along these fibers. But sometimes when we feel anxiety, the communication does not flow well. So several parts of the brain, in producing fear, and scientists have discovered that the amygdala and the hippocampus, which we know is within the emotional side of the brain, plays a significant role in anxiety. So the amygdala will alert the rest of the brain that a threat is present and to trigger the fear or anxiety response. So right there and then, that says to me that anxiety and fear is produced from the same part of the brain within the limbic system. So that will help us understand why when we feel anxiety, it feels just like fear, doesn't it? And so the emotional brain restored in the central part of the brain play a role in anxiety disorders and involving very distinct fears, such as whether it's dogs, spiders, etc. So the hippocampus is the part of the brain that encodes threatening events into memory. So it's like, okay, I experienced this threatening event. The amygdala done send out the response to my body going to fight or flight. My hippocampus coming tailing the trail now to ingrain this into memory. So now in the future, every time I see something resembling what I was afraid of, it's a next signal now, and it's a next alert, and it's a cycle, it's a repetition, right? And in addition, certain parts of the brain become dormant and drive behavior. So this is why you'll find you'll have flashbacks or what we call trauma. This is what is happening, right? So the left brain loves logic and uses language to describe experience in a concrete, logical way. It gives structure and order to our experience. The right brain is more concerned with emotion and the bigger picture of what the experience means. It draws on memories, feelings, images, and heavily directed by sensations in the body and sends messages to the lower brain, right? Which is a major anxiety player. And during anxiety, it's likely that the right brain does actually take over. And the right brain is only concerned with emotions. So if when we anxious, the right brain is taking over, do you understand what that means? Your emotional brain is actually taking over when you're anxious. And you could feel overwhelmed, right? So every physical symptom that comes with anxiety, your racing heart, your sick tummy, your clammy skin, your vomiting, whatever you experience is because there's a surge of neurochemicals. The natural end to fight or flight response is intense physical activity. So if the threat was real, they'll be fighting for their lives or you'll be running from it. Pick, right? But when there's no need to fight or flight, there's nothing to burn up the neurochemicals and they build up, causing the physical symptoms of anxiety. So what that means is when that right-sided brain, they send out that neurochemicals that make us feel anxious or make us feel fearful. If there is an imminent danger, we fight or flight. But if there's none, all we feel is anxious because there's nothing to burn up the neurochemicals. So all we feel is overwhelmed or worry, etc. And all the other anxiety emotions that we feel. So this is to tell you that the next time someone says to you that your anxiety is not real, put it out of your head, or someone try to invalidate, whether intentional or unintentional, because sometimes people don't know better, what is happening, just know that this is literally something that's actually taking place in your brain. And this is what it looks like. So you see the amygdala at the bottom and hippocampus, these two running the show with anxiety. So now, how do different parts of the brain respond when you're stressed? Your survival brain, he likes to make your heart beat faster so you can breathe more oxygen in case you need to fight or in case you need to run. And he will send energy down to your limbs so you can move faster or be stronger. Your emotional brain, and I know a lot of us could identify with this, becomes more intense. Our emotions are indicators for us. It's like our little warning system goes up, our red flags goes up. And then we have the smart brain. Now, when there's an imminent threat or you're feeling stress or anxiety, this smart brain goes offline. He's like, I'm not dealing with this. This is not my space.
Thank you so much. Andrea, feel free to proceed. Thank you all for being so patient.
I'm sorry about that. Electricity just, okay. Tell me, y'all could see again?
Yes, we can.
Okay, beautiful. Right. So like I said, there's the smart brain, when we feel anxious, goes offline. He's not about it. He's like, I am getting out of here. I don't care what you're doing. And that energy that your smart brain would usually use is used to prioritize the other brain and body systems, right? So now, what are some triggers and risk factors? We hear what people think anxiety is, what it really is, the science behind anxiety. What triggers us though? Why this happening to us, right? So everyone experiences anxiety differently. So it's hard to know exactly what causes anxiety problems. And there's actually a lot of factors involved. So you have your past childhood experiences. So people who have difficult experiences in childhood, adolescence, or adulthood are a common trigger for anxiety problems. So going through stress and trauma when you're very young, or physical, emotional abuse, persons who have been neglected, persons who lost a parent, persons who have experienced bullying or being socially excluded, or even experiencing racism. This can cause them to have anxiety in the future, right? Your current problems in your life right now can be a trigger for anxiety. If you're stressed, if you're exhausted, if you're feeling under pressure, if there's a lot of change or uncertainty in a transition phase, that can help cause anxiety. Working long hours, being out of work, having money problems or household problems, or even persons who are homeless can experience anxiety. You know, you're worrying. It's a persons who worry about natural disasters or freak accidents happening, feeling lonely or isolated. And then there are those who have physical or mental problems. Those are also triggers. So you have a life-threatening condition going on. You have depression, and depression and anxiety often happen together, right? The next one is drugs or medication. Some negative side effects of some drugs can cause anxiety, and even taking recreational drug or alcohol can cause anxiety, right? So some others that are not listed here, and some are negative self-talk, social settings, emotional overwhelm, trauma. Even trying something new can make you feel anxious. Having a deadline. I know many persons' deadlines make them feel anxious, and when you have that perfectionist state of mind or personality, you could be in a constant state of anxiousness. Being feared of being judged or rejected can make you feel anxious. Thinking the thought patterns that everything will go wrong. Conflict. Some people get anxious when they think about having a conflict or to have a confrontation or a difficult conversation. And like we said, loneliness. So all of these put us at risk for anxiety. Now let's look at some statistics on anxiety, and these were kind of a little bit mind-blowing, right? So we're going to look at statistics globally, statistics on age, sex, education, and race. So the truth is that anxiety statistics worldwide actually shows that anxiety disorders are common across the world. An estimated 275 million people suffer from anxiety disorders globally. That's actually around 4% of the global population, with a spread of between 2.5 and 6.5% of the population per country. Now, the statistic, as in the percentage, may sound small, but the raw figure is actually very large. Imagine in 2022, there are 275 million persons who suffer with anxiety. And in the first year with COVID, actually, the prevalence of anxiety and depression increased by 25%. And the prevalence of all mental health disorders increased by 50% between 1990 and 2013. So now let's look at age. You would think, what does anxiety and age have to do with each other? Now, according to the National Institute of Mental Health, the incidence of anxiety disorders does vary by age. Depending on your age, increase, decrease. Some people may have a predisposition to anxiety, right? So anxiety disorders in adults are seen in 22.3% of those aged 18 to 29 and 22.7% of people ages 30 to 44. So the prevalence of anxiety disorders drops to 20.6% for persons aged 45 or 59. I wonder if that means if we get older, it will start to get better. And anxiety in older adults is less common. Actually, it's only 9% of persons 60 and over have anxiety. However, in those teenagers, it is shown that they have a lifetime prevalence rate of anxiety disorders. So people 13 to 14 were seen to have 31.4%, 15 to 16, 32.1, and 17, 18, 32.3, meaning that as they grew up in age during their teenage or adolescent years, the anxiety increased. Now, sex. Anxiety disorders in women are more common than anxiety disorders in men. Around actually 62% of those suffering from anxiety is female. There's 170 million people out of those that we said. And compared to only 105 million, which is 38% of male sufferers. And in the past year, 23.4% of women experienced an anxiety disorder, compared to 14.3% of men. Education. Now, you would think, getting education is a good thing. We always encourage to pursue education, right? But persons with higher education have been seen to have less likely an anxiety disorder. Anxiety affects 3.9 million adults who have less than a high school education, 3.3 who have graduated high school, 2.8 with some college, and 3 million who had a college education and more. And a Canadian study found that each additional level of education, people were 15% more likely to see a psychiatrist. Does anxiety differ by race? The thing is, the prevalence of anxiety disorders do vary by race. And one study found that white Americans demonstrate more anxiety sometimes when compared to other minority groups. However, post-traumatic stress was seen to be more common among African Americans, and Asians demonstrate consistently lower rates of anxiety disorders when compared to others. Now, this would be interesting an area to explore. Unfortunately, there's a paucity of literature when it comes to Trinidad and Tobago or the Caribbean in terms of mental health statistics, and that's an area we really need to be working in, right? So, however, I was able to find that in Latin America and the Caribbean, anxiety and depression actually account for 50% of mental health disorders amongst adolescents aged 10 to 19. So that means anxiety and depression is top billing in the mental health issues for our adolescents. Now, how does it affect us? Now we're learning all of this. Anxiety is pervasive, there's a high prevalence, we understand how it works in the brain, but now how does it affect our life? As persons who live with anxiety or know someone who lives with anxiety, anxiety can have a severe effect on a person's life. Struggling with the disorder can lead to a diminished self-confidence, strained relationships, or substance abuse, among other repercussions. Now, someone with social anxiety disorder may avoid social interaction due to fearing how their peers may perceive them, and different types, right? So anxiety, the quality of life is actually the biggest problem that anxiety causes for a person. It causes them to have a lower quality of life. Your family is not just the person who's suffering. Anxiety has an effect on the family of this person. So anxiety can put a lot of strain on your relationships, and this can become very isolating. Family and friends maybe feel strained or stressed by your anxiety, as well as because they don't want to see the persons that they love suffer, and they don't always know how to help that person. And that is one of the next area that needs to explore in terms of educating our loved ones on how to help us when we feel anxious, or how to live and love a person who suffers with anxiety. And lastly, it has an effect on our relationships. So we are social creatures by nature, and having a good relationship is crucial to our happiness. Unfortunately, anxiety disorders have been known to be very hard on relationships. So, because anxiety can limit your willingness even to do new things, even with your friends, or to meet new people. And if a person has social anxiety, they have that fear of going out, and we place up a certain premium on being accepted in society, and that can be difficult when you have anxiety. And so people become socially isolated. Anxiety can impact your relationships in a number of different ways, depending on the symptoms they're experiencing. For some, it might even cause them to become overly dependent on their loved ones, because that's where they feel safe, right? But alternately, some might isolate themselves because they feel too embarrassed. So it's two extremes when someone is experiencing or dealing and battling with anxiety. So that was for me, just to give you a little taster. There's more to come. So I want to thank you for listening. And if you have questions as well, we have a question and answer portion that you get to ask anything or make your comments. So thank you for listening to me. I'll now pass you over to Mrs. Bassett.
Thank you so much, Andrea. Let's show some love to Andrea. And we can pause here for a minute and at least take one question. If you're brave enough, if you have any concerns, any questions that you want to ask Andrea at this moment, please feel free. One person, just raise your hand and ask your question to Andrea. Good job, Andrea. Excellent.
Thank you very much, everyone. Thank you.
Such an important factor to understand. And I'm looking in the space this evening, and we're all females. Yes, correct, females. And it's so noteworthy to point out that mostly women. It's high on the spectrum for women in regards to anxiety. So thank you for helping us understand through your presentation what is happening in our brain, because we all have moments of feeling anxious, and then it goes to the extreme. So really thank you for that. Please be reminded to keep your mics on mute. So as we go along this evening, it's getting a little more exciting. So we didn't see any questions for you, Andrea, as yet. And so I want to now introduce our second featured speaker, all the way from the UK. So the Trinidadians in the midst, we should show her some love. Rachel is a life coach, a psychotherapist, clinical trauma specialist. She has worked in the health and medical sector. One second, give me a second. She has worked in the health and medical sector for the past 10 years. She has worked in National Health Service, trained and volunteered for some UK well-known charity services such as Victim Support, Maytree, Samaritans, and much more. Such a warm individual. She's a woman with a passion for helping people move forward and heal difficult moments in their lives. When she's not working or volunteering, she enjoys socializing, attending book clubs, exercising, and flower arranging. She's also the proud owner and lead with her very own Practice Mental Lighthouse in the United Kingdom. It is my pleasure and my honor to welcome this evening, and let's show her some Trinidad love. And I know we have someone else from the UK here with us. So let's show them some love this evening as I invite Rachel to the stage. Welcome.
Thank you, Danielle. Thank you very much. Thank you everyone for also being here today. We really appreciate it. So I am from the UK, and I will give a little bit of a spin on the UK and how things are here in terms of anxiety and the overlap as well, if that's okay for this evening. So I'll begin with discussing some of the most common types of anxiety disorder. And the first one that we have, which is quite common, would be panic disorder. Panic disorder is seen as when some... Hello, yeah.
Excuse me, free to share your screen.
Oh, is it not coming up? Sorry about that. Let me just go here. Sorry about that, guys. Okay, can you see my screen now, please? If you can see my screen, just let me know in the chat. Oh, perfect. Thank you. Thank you for that. So I'm just gonna do this. Okay, I think we went forward there. So I was saying about panic disorder and how panic disorder affects people across the globe. Now, panic disorder is seen as reoccurring anxiety that keeps occurring. So you keep having frequent panic attacks. So this might look like having panic attacks every 2 or 3 days in a week or more than that. And it can be quite distressing for someone experiencing this. And also, just because someone has panic attacks, it doesn't mean necessarily that they have panic disorder, because in order to be diagnosed with panic disorder, it has to meet certain criteria, which Andrea also lightly touched on, which would be that it has to be a regular occurrence. It can't just be an occasional thing or a one-off sort of experience. And you also have obsessive compulsive disorder. This is where you have intrusions, thoughts and compulsions that affect you nearly every moment of the day and even also at night. There's different types of obsessive compulsive disorder. You have types such as RG, you've also got pure O, and these would sector into, pure O is more the common type of obsessive compulsive disorder that we tend to see rather than other types. And that might look like, you know, someone focusing on their thoughts and intrusions every single moment of the day. You know, they might have a thought that sometimes it's a horrific thought, and other times it might be something as simple as, did I turn off my stove? And having the feeling to go back and look at that and thinking about it, ruminating about it, thinking really hard about it, and just getting all these different thoughts coming at you. And as Andrea said earlier, I believe that it feels as if you don't control your own thoughts. This is what we tend to hear people say when it also comes to obsessive compulsive disorder. You feel very compelled to also use coping strategies such as cleaning, for example. That's a common one that individuals use. And sometimes you might feel to pick your skin or pull your hair. Those are some things that is caused because of obsessive compulsive disorder. So look out for those if you have any friends or family members who are displaying these symptoms. And then we've also got up, which is post-traumatic stress disorder. So this is where individuals might have flashbacks and lots of nightmares as well. It's also intrusions. So it makes you believe as if you are having an experience, a past painful learning experience, as if it's happening right now. So victims of a certain experience, I'm mindful of not triggering anyone here today, You know, you might have a certain experience, or you might know of someone who had a very gruesome experience. When I was with victim support, there was quite a lot of horrific incidents that happened for women, and you know, they would have a lot of nightmares and tension, intrusions, and they would smell, you know, the experience all over again. And these are some of the things that happen in individuals who have post-traumatic stress disorder. Social anxiety disorder is also another common one which we tend to see. And this is where someone might feel very anxious. Let's say if they were doing a talk like this, or doing a workshop or presentation, a speaking engagement, they would feel very, very anxious and nervous, to the point where they might, you know, again, feel churning in their stomach. They might get really ill. They might fumble on their words. You might see them sweating. They just feel very anxious. And also meeting new people in a group, or just a stranger, can trigger off anxiety in those social types of situations. And then lastly, in the category that I've listed on the presentation here, is generalized anxiety disorder. This is a very huge one in the UK, which basically is having feelings of excessive worry all the time. This is all the time. And it's worrying about daily life events, things that you might not be able to control. You might think thoughts such as, you might worry about things such as, oh my goodness, my train's going to be late again. Oh my God, I forgot to make my bed. All these types of thoughts that happen day to day are focused upon. And then leading on to that, we might as well look at some of the causes of these common types of anxiety. So the symptoms of these would be being irritable, having sleep problems. So those would come under post-traumatic stress disorder when you're having sleep issues, and also under panic disorder as well, and generalized anxiety disorder. Being on edge, and also having intrusive thoughts and unexplained stomach aches and pains, and also feelings of dread, would also fall under generalized anxiety disorder. Most of the symptoms sometimes can overlap, but and sometimes it's hard for clinicians to diagnose what exactly to pinpoint the actual anxiety disorder. And this is when we have further tools and assessments that we might use, which can actually pinpoint us to a more accurate diagnosis. And sometimes it's possible to have generalized anxiety disorder combined with social anxiety disorder and even depression. It's all interlinked, as Andrea also said earlier. And what we tend to find is, you know, somebody with social anxiety disorder, they might be on edge, looking around every minute if they're at a party, or if they are at a speaking engagement. This is more, teenagers would do this a lot as well as adults, look around, and you know, they just feel you can see that this person is in a state of stress or panic. And this is where their fight or flight mode their response is kicking in. And it's about trying to, when we do work with them later on down the line, that comes down to figuring out how to get them back into the parasympathetic state, which is for rest and digestion, so that you're in a calm state, the body's regulated, and you feel at ease again within your body. So on to causes for the anxiety disorders. Now, Andrea mentioned this earlier herself as well, speaking on childhood trauma. That can be one of the causes of you actually being diagnosed, receiving a diagnosis of a anxiety disorder. So it can be quite traumatic. And then, you know, you have to look at ACE scores as well, which factors into a more in-depth picture of the child's background when they were growing up and how things have shaped them into who they are today. And that might overlap with substance misuse and drug issues there as well, especially if you had parents who were alcohol dependent or they used various other substances. That can put you in a state of anxiety. There are children who are in homes where, until they're picked up by social services, of course, but there are children who are in homes right now in different places and they don't feel safe, and they are looking after or experiencing abusive natures within the home of a parent who is an alcoholic, who's alcohol dependent, and because of this, sometimes they might lose school and other things as well. And it's a very stressful and anxious environment for the child growing up. And it also affects their attachment style as they go on with how they deal with people and relationships and how they function in the work environment as they get on. Another one that we have, another cause, would be a stressful event or shocking life experience. So that can tie back into childhood or even as an adult. You might, a famous one was the 9/11, unfortunately, that great tragedy there that happened. And there was a study that was done, I believe it was Harvard or Yale, but I believe it was Harvard anyway. And they did a study to test two groups of people. And what they found was both groups experienced the same trauma in the environment, with people jumping out of buildings and the horrific sides of that. And what happened was one group didn't heal and they stayed in a state of the sympathetic nervous system, highly stressed, fight or flight mode. They're alert, their natural bodily system going off there and just not functioning at an optimal level, scared, feeling petrified, looking around, feeling jittery and on edge wherever they are. This could be in the supermarket, or it could be out walking with a friend and they just have something come back to them. And this then would develop into post-traumatic stress disorder, which I spoke about earlier for those individuals, for that first group. The second group, what they found, which was very interesting, is the group that stayed in contact with any relatives that they had remaining and any loved ones or friends, close friends. They found that, and they got them into themselves into therapy, they found that that group there, they found that group B actually recovered much easier, better, should I say, than the first group, and it didn't actually develop into post-traumatic stress disorder. So this is where it can become a bit tricky, where if help isn't received, if help isn't sought out, then this is where you get the high statistics, as Andrea spoke about, within the communities here, where we need to support each other and actually understand that therapy is the ultimate self-care, looking after your mental well-being and your state. And that just is a very powerful study that illustrates the difference between doing something and sitting with these experiences until they develop into a much bigger problem later. And I also touched on environment when I spoke on childhood as well, but for the sake of it being here, environment. So as an adult, it's important to, let's say you've had childhood trauma, or you might not have had childhood trauma that you feel affected you. As an adult, you might find yourself picking similar partners who were like your parents, who might have been substance misusers, and it's a cycle that repeats, and that's being in an environment that's similar to when you were a child. And it can be quite subtle, and we might not be aware of it, because it's until they get there they realize, oh my goodness, an individual gets there, they're like, oh my goodness, this is just like when I was a child. I'm in the same situation, the same environment, and then it brings back all these feelings of anxiety and all these problems once again, and then they feel like they're experiencing deja vu. And this is because of unconscious biases and past painful learning and the trauma that had occurred. And then the final one that I have here for causes would be the biological and genetic reasons. That's the coding that we're made up with. Now, if you have a parent or an aunt who has had anxiety or other conditions such as depression, but for the nature of this talk, anxiety, and then you also go back further along, when we actually work with people, we all, clinicians, as Daniel and myself, we find that it goes back generations sometimes, or it might skip one generation and go to another. But there is usually a genetic coding in there, biological coding, that we trace back, and we can see that this is a hereditary cause also for some individuals. It's like obsessive compulsive disorder. That can also be traced back genetically as well. So if you know someone, or if you are experiencing this yourself, you might be able to trace it back to your family line, that someone you're close to or you're related to also had a similar condition. Now I will move on to ways of reducing and treating anxiety. This can be this is the interesting part for tonight. So I will talk about therapy and counselling and somatic practitioners first, because even though it's at the bottom, it's very necessary for individuals who are experiencing anxiety and other conditions to go for therapy. There are some very good therapy frameworks out there that have really helped people with anxiety. For example, social anxiety disorder and OCD, obsessive compulsive disorder, and even generalized anxiety disorder. It's evidence-based treatments we've found in therapy, such as cognitive behavioral therapy, and also even cognitive processing therapy, that is very effective for those anxiety types. And counseling also is very helpful for individuals who are going through anxiety as well, because they get a safe space and place to be heard, and then they can implement the various other treatment plans that they have been given to help them recover, which would be things like medication as well, sertraline and diazepam, Xanax, and so forth. It's a combination. So clinicians have found that therapy, counseling, somatic practitioners, and medication they complement each other very well in terms of treating and reducing anxiety. Somatic practitioners, I'm not sure who has heard of somatic practitioners, but this is the practitioners, the workers who help people also with trauma. So this might be, touching the body or learning specific breathing exercises. They focus more on the bodies, more of a holistic approach. And they use tools such as, I've got on here EFT, which is emotional freedom technique. If anyone's heard of it, please drop it in the chat that you've heard of emotional freedom technique. And what it is, emotional freedom technique, is tapping on the 12 acupressure points of the body's system, the meridians, as the Chinese philosophers would once call it. And then you've also got thought feedback therapy, which is very similar to EFT, but the nature of it is just tapping. So if you're feeling anxious, anyone right now, if you just tap your karate chop right here, if you just use 2 fingers and tap that right there and just breathe, you should start feeling a little calmer. And you can't get this wrong because it's just tapping this space very gently. And it's a lot of patients and clients have found this very soothing. I mean, in hospitals, for example, if you seem to get anxious in hospitals, this is very discreet because I can't really show you now, but if you're sitting down and you're just tapping like this, it's quite discreet. You can cover it. No one will know that you are feeling anxious in the doctor's room or hospital waiting area. And that's why it's quite a very loved, much loved and appreciated tapping point. And then of course you've got the eyebrow where you would tap, and then you've also got the eye crease right there, and then you've also got the under eye, and then you've got the top of the mouth and under your chin, of course, and then you've also got your collarbone right there, and then it would be just under your armpit, just down where your rib cage is right there, and then the top of your head right here. So these are there are also more, because I mentioned 12, I just did 8. The other 12 would be tapping here in the middle, and then tapping near the thumb as well, and then just pressing as well. So there are different ways and knowing different parts of the body to touch to relieve the anxiety. And that was emotional freedom technique. You also have exercise that's listed as one way to reduce anxiety. So of course, anxiety, you know, it troubles in us all these chemicals, fight or flight response mode, but exercise actually levels out the chemicals in our brain, and they also increase the feel-good hormones. So exactly what we once believed that other inhibitors, serotonin inhibitors, were doing, the exercise does that for us. And exercise can also give you a way to actually push through all that pressure and that tension as you're running. If you're a runner, it will, you know, help you push through all the tension, and your body can go back to a state of feeling at ease again, because you've taken the energy and you've moved the anxiety, and you've shifted your mental state, the chemicals within the brain. And also the next one that I will speak about here is guided journaling. So for this, I mean, some individuals prefer to work with a therapist when they're doing guided journaling anyway. However, you've also got individuals who are happy to do guided journaling on their own, because you can do it also on your own. And then there's, of course, free flow journaling. If you're not into journaling, I may suggest that you could try morning pages. So this isn't a clinical one, but this is still a way of writing out what is in your mind. And in terms of anxiety, some clients and patients, and in studies, they've reported, you know, writing their first thoughts out in the morning, just scribbling it down on a piece of paper, scribbling it down just there, helps them to get out most of what is in their head in those 5 or 10 minutes. So that might be another tool that might be helpful for someone here today, or something you can pass on to a friend or relative who might need this exercise. And of course, mindfulness as well. You've got mindfulness. So taking time to do mindful walks or meditation as well. But meditation, the first thing is you need to, the reason why I did not put meditation here as one of the top treatments and reducers for anxiety is because before you can actually learn to meditate, you have to get into a state of relaxation. Because what research has found as well, and I've heard other colleagues, clinical colleagues have found also, is that, and I've listened to other clients and people say what their first experience of meditation was when they tried this, and they are, you know, clinically diagnosed with different anxiety disorders. But they find that when they actually do try to meditate, that's when more chatter comes, more intrusions come. So the mind is filled with more of these thoughts, and it's even more overwhelming and intense. So until and unless a therapist or counselor or somatic practitioner teaches them emotional regulation, get them into a parasympathetic state, then it is quite difficult without this to do meditation in the way that someone who doesn't have an anxiety disorder might, because of course we all have thoughts, but it's the focus with anxiety disorders, that's when it becomes the issue, as we have heard today. And of course, I also have here 3 things. So you can feel, what can you feel, what can you hear, and what can you touch? So if someone's in a state of a very highly stressed, aroused, anxious state, and you're with that person, maybe give them something, like your hand, your hand, and ask them what can they feel, and they will tell you. It brings them back to the here and now rather than in future thinking, which is the anxious state. So if they can feel your hand, or even if they, maybe they don't like touching hands because they have OCD, right? They think germs, I don't want to touch anyone's hand. Maybe you can give them sanitizer to hold, and you can tell them, this is a sanitizer. This is hand sanitizer. What do you feel as you touch the hand sanitizer? And then you can also ask them, what are they hearing around them? Are they hearing complete silence? Are they hearing the way that you're breathing? And it can help them regulate their breathing. It's a way of getting them back into the body to get stillness and grounding. And then also, I will move on to how it would now differ in terms of children and adults, anxiety in children and adults. So for any parents on the call, please take note of this section because it's very important. Children are little babies or even teenagers. They can't tell us everything. They can't always feel that they can express what they need to, whether it's through words or through emotions. So they might communicate through an action. It's just like when a baby cries and they're hungry. They can't say, I'm hungry, mum. They have to cry. And then eventually we learn they are hungry, or whatever the case might be, or they're in pain if they can't articulate that. So in terms of anxiety, children tend to go to the toilet more regularly. So let's say Bobby or Susie were used to go to the loo. You notice as a parent, they go to the loo maybe 6 times for the day. Instead, they're going 12 or more frequently than that. And you check that they don't have a urine infection, because your urine infection can also make you go to the toilet frequently also. However, this has been checked, and at first you're not really having the signs and symptoms come together. So you're thinking, okay, my child doesn't have a urine infection, they don't have a tummy bug, the doctor's ruled out all of these things. You might want to see if it's paired with any of these other symptoms, to then go back to the GP and say, the doctor, and say, I'm not 100% sure, but can we just check that my child isn't experiencing a form of anxiety? So children tend to want to sleep with their parents. They might have nightmares, or they just can't sleep, and they feel safer. They feel safer and more cuddled and held in a safe space with mummy and daddy. That's one way that they are communicating that they're having anxious feelings. There's discomfort, there's dis-ease there, a state of dis-ease, and also not being able to concentrate. So let's say they were a straight A student, or they were always on top of their homework. This is a child who's maybe 7 or 9 years old, or even 12, teenager, and they start to dip with their coursework, their homework, or you notice that you're talking to them and their attention is elsewhere. You have checked that they do not have ADHD, attention deficit hyperactivity disorder, and you realize that something is off. So that might be where you need to also have another chat with the doctor. And then, of course, bedwetting. This is, I think, one of the most common, possibly first symptoms that you might see at the top with sleeping with the parents. So in terms of bedwetting, it's anxiety. So it could be stress also. But then in order to have the stressor, there was some type of trigger and anxiety that has led up to this point of the bedwetting. They might be worried if daddy's ill or mummy's ill, if mummy might, pass away or daddy may no longer be around, and they start bedwetting, especially if they know that their parent is or their caregiver is terminally ill or has a very lifelong condition, which puts them in a state of anxiety, panic. Also, being in, I will just make a note of say this here as well, because it is just to be stored in the back of the mind. But if a child is also in a home of domestic abuse, there tends to also be bedwetting as well. So that's just another thing to be aware of in case you come across something like that in terms of safeguarding issues. And then, of course, with children, you also have angry outbursts. So little Bobby or little Timmy or little, Shelley, they might not be able to say again, Mom, Dad, I'm having all these experiences within my body. I don't feel safe. I feel on edge. I just don't feel okay. I'm having all these thoughts come to me. I need help. So they might get irritable and actually have an anger outburst. And this is something, sometimes children are reprimanded for being naughty, or, a parent could be scrutinized in public to say, oh, you can't control your child. But outsiders, don't worry about what they say, because it's about what's happening with your child and with you. That's always the main focus. Because if you can understand how to read your children or your child's triggers and symptoms, this is what we classify as conscious parenting. You've got unconscious parenting and you've got conscious parenting. That is conscious parenting. Rather than worrying about what people say or think, you look to the well-being of your child and the relationship with your child. And then comparing that to adults, anxiety in adults tend to feel a sense of dread, maybe as if they're about to die or the world will end. I've heard this also, which I'm sure Danielle has as well, and so has Andrea. People saying they feel a state of dread. And also, adults will experience heart racing as well and shortness of breath. And the shortness of breath is where you would then see the possible panic attack coming. Not always, but this is where it might possibly come in for an individual who would then have panic disorder or panic attacks. And of course, they focus readily on the heartbeat as well. That's another thing that happens there. And then you've also got constant worrying, or what some people would then call fear. But as we know, as clinicians, it's not really fear because it comes from the same part in the brain, but it's just the way that individual might identify it. That's the best way, or terminology, words they can use to explain as an adult what they are feeling or believe this emotional experience is. And on top of that, it goes back also to feeling nervous and on edge. So if you see any adults or children who are experiencing any of these symptoms, or you've got a friend who you know, has a child and they're both going through this at the same time, then they are both most likely experiencing anxiety. And, you know, it might be worth having a chat with them about that, depending on how close you are as well. So this is the end of my part in the presentation. I thank you very much for listening, and I'm happy to take any questions as well, if Danielle would allow and time would allow.
Okay, any questions? Anybody? Okay, in the meantime, I just want to thank Rachel for her excellent presentation, for educating us and building our.
There's a question in the chat.
Oh,
Around what age group for children, Rachel?
Okay,
Oh, nice.
so for the age group, I would say in terms of that, you've got from about 4 till about 12, 13. That's the cutoff for that age group. Because once you go towards, you know, 15, you're going in towards being a teenager and then adulthood after that. So it changes slightly, as we mentioned a moment ago. So 4 to 13, yes.
Okay, beautiful. Anybody have any more questions? Don't be shy. Well, if you don't want to right now, you will have a chance in the Q&A portion.
Yeah.
You can take this time to write down your questions.
Yeah.
So I just want to really thank Rachel. Oh, you're welcome, Marie. Rachel,
Thank
Marie.
you. Thank you, Andrea and Marie. Thank you.
Yeah, thank you so much. So we're going to just take a 2-minute break, get some water, stretch your legs, and then we will have a short presentation by Mrs. Placide before we get into a little bit of discussion. So we're just going to get 2 minutes, guys. Run, get your water, stretch your legs, and come back. We're right there. We'll begin soon. Okay, everyone, and we are back. We are on. We have been having a rich discussion and presentation on anxiety. And now, without further ado, I would like to introduce our final presenter. This is Danielle. Danielle is a family life counselor, certified trauma and grief specialist, and empowerment coach. She considers the counseling room a sacred space where deep heart changes occurs. Her warm, supportive, collaborative, person-centered, and faith-based approach allows her clients to feel safe while sharing their truth, hurt, and pain. Let us give our virtual round of applause for Ms. Danielle. Welcome.
Hey everybody, I am so excited this evening. I trust that you all are having a fabulous time as I am learning so much. So it's important for us when we do. Thank you, Andrea, for that warm welcome. Thank you, Rachel, for that very informative session as well. It is very important when we, you know, have a virtual space to feel the love of everyone. So we want to take a minute and share some love for Rachel and Andrea for such a fabulous session this evening. They already did a fabulous session. So show some love in the chat. We're not seeing the love coming, but I know the love is there. Good. Thank you. Thank you. Thank you. Thank you. Show some love. Yes. Good. Very good. Truly, truly. Great session. We'll be over soon. Wonderful. Thank you so much. So bear with me for a minute as we have spoken about what is anxiety. We spoke about triggers. We spoke about causes. We understood the brain from Andrea. We understood the difference between the child, what a child would experience from an adult would experience from Rachel. And we just got a wealth of information for us to work with. But one of the important factors that I want us to consider this evening is avoidance and safety behaviors. When we feel anxious or expect to feel anxious, we often act in one or two ways. And that is by doing avoidance or safety behaviors. So what is avoidance? And please remember to ask your questions in the chat, or if something resonates with you, please put it in the chat so that we can see, or if you want to make a comment or suggestion, feel free to do so. So avoidance is typically considered maladaptive behaviors that are not normal. Maladaptive behavior responds to excessive fear and anxiety, which leads to the maintenance of anxiety disorder. Very important for us to consider. Maladaptive behavioral response to excessive fear and anxiety, leading to the maintenance of anxiety disorders. And put a pin right there, maintenance of anxiety disorders. Now, when we talk about avoidance, so we're having this anxious moment. When we talk about avoidance, there are different categories of avoidance, and we will share some examples, but let's understand the classifications of avoidance. So we have situational avoidance, and if it resonates with you, please let me know in the chat. This refers to staying away from people. So you are having anxiety, you are having that anxious moment, and you decide, you know what? I'm not going to that function. I'm not going to that event. So you stay away from people, you stay away from places, things, or activities that feel triggering or activating to you. So it's not a case where you don't want to go, but it's a case where you are afraid of being triggered or experiencing the sensations in your body. You're having an anxiety attack or a panic attack. So if this is you, drop it in the chat. You probably just put S, situational avoidance. And then we have cognitive avoidance. This type of avoidance is an inside job. We're talking about the mind, right? Which refers to actively turning your mind away from distressing thoughts or memories. So you're talking to yourself now. Stop thinking this. I'm not going to think this. Okay, turn this off. And you're actually trying to turn the mind off from the thing that is making you anxious. Does this happen to anybody? And so you're telling yourself things like, don't think about this. Or it could also take the form of distracting yourself or disassociating, fantasizing, and something very famous that we do in our country, I'm not sure about with Rachel, we do toxic positivity. So you would hear things like, girl, you're going to bounce back just now. Boy, don't worry, that's just a moment you're having. And while people may mean well, they may not say the right thing for the moment. Then we have protective avoidance, which refers to actions in your physical environment that help you to feel safer in the world. For instance, cleaning all the time, shopping all the time. And this may lean heavily on obsessive compulsive disorders, washing your hands all the time so that you wouldn't pick up some sort of germ. Perfectionism, over preparing for your class, or you have to teach, or you have to sing. If you're faith-based like me, you have to prepare a sermon. You're over analyzing until you paralyze yourself. Does that happen to anybody? It goes beyond preparation. It's you second guessing yourself all the time. So you want to avoid something happening, right? Then we have somatic avoidance. This avoidance refers to staying clear from situations that elicit a physical response. So if you know when you exercise, you are going to get that feeling like you're having anxiety, there is no more exercising for you. There is nothing that you would want to do. You avoid things that deals with the sensations of the body. So exciting events, you will not go on the hike because you feel as though you will have that moment and you will not be able to control it. And we hear a lot of people say, I feel like I'm going to pass out, I'm not going to make it. So please remember, it's maladaptive behavioral response, excessive fear or anxiety. Anybody got anything so far? Good. So let's before I go to the safety behaviors, let me share some more examples for you. You have an excuse ready to avoid leaving a situation. So we go to a function, you know that you have anxiety or panic attacks, you make an excuse to let people know that you're leaving early. That happens to anybody? You don't travel on the bus, or for those who are not in Trinidad, you don't travel on the train because it may may raise your anxiety experience. You refuse to fly or to travel. And for those who write in Trinidad, you may not even want to go to Tobago. A 15 to 20 minutes flight may put you in a difficult position. You don't go anywhere that isn't close to a hospital. It reminds you of a traumatic event. And Rachel would have bring it up, childhood trauma. So you may have had persons in your family that have had difficult health situations, and going to the hospital, going to a simple clinic appointment may put you in an anxiety space. All right. Avoid work meetings, because why? They may ask you a question that you don't want to answer. So you make an excuse and you don't go to work meetings. Or if work meetings is mandatory, you find yourself, you don't want to make eye contact with anybody. And so, you try to avoid those situations. So those are just one way that when we feel anxious, we are experiencing anxiety, we do what we call avoidance. Secondly, we can engage in safety behaviors. So this is now not a case where you're not going to the event or you are avoiding the space or persons or people. This is where it's used in an attempt to prevent the fear from coming true and to feel more comfortable in situations when you are anxious. For instance, and you know what, you may not realize it, but part of your brain continuously monitors the environment for physical threat. And Andrea would have noted that. And so our brains are always looking, and that's normal for threat. So here's what you do. You now engage in props, I would call it, props to help you cope in the moment. And so it is, and safety behaviors may be very different for different people because of what your experience is. It is not what you do, but why you are doing it that determines whether something is considered a safety behavior. For instance, and please be reminded to keep your mics on mute. For instance, staying quiet in social situations. You can stay very quiet so that nobody will ask you a question. Wearing headphones on public transport, not because you are listening to music, because you don't want anybody to ask you anything because you may get anxious. Walking with things like mints or sweet foods or water all the time. And I want to do a bit of self-disclosure here. I don't know, you could put it in the chat a bit for those of you, anybody know what Vicks is? Let me know, come. Everybody in Trinidad know what Vicks is. Andrea, do you know what Vicks is?
Yes, I do. It doesn't feel like the same Vicks like long time, but I know what Vicks is.
Good. So I have had the experience with feeling very anxious in moments. So I would walk around with Vicks in my bag because I like to smell it. It calms me. And so that is a safety behavior. So the minute I put that by my nose, I am fine. So that's a bit of safety, self-disclosure. Sitting next to exit doors so that in the event of anything, I can just dash out immediately. That happens to anybody. Avoiding making eye contact. What about dating? Avoid going on dates. Avoid having relationships. Avoid, you said, you know what? I'm going to hang out with you, but I don't want you to be my boyfriend because you don't want to have that anxious feeling with you. So it's safety behavior. So if you are uncertain, and you're probably asking yourself some questions right now, if you are uncertain whether something is a safety behavior or not, because we don't want you to go about getting paranoid about everything you have in your bag or everything you have in your possession and wondering if it's a safety behavior, ask yourself this question. How anxious would I feel if I could not do this particular thing? So if I have to travel, do I really have to walk with the headphones? How anxious would I feel if I could do without this thing? If you would feel anxious without behavior, it is probably a safety behavior. But here's what. Many people who have experienced an anxiety or panic attack start to dread having another. So you have had one and you don't want to experience it because of those sensations in your body and what you feel and the lack of air, and you feel like you're going to pass out and all that. To avoid all of that, you develop safety behaviors. However, avoiding situations or activities or using safety behaviors to cope with them may reduce the anxiety we feel for a short-term basis. It's an illusion. It's an illusion of control. It gives you a false hope that you are in control of the situation, which the anxiety tends to sometimes grow in strength. So then we ask ourselves, why are safety behaviors a problem? So you may be having safety behaviors right now, and I'm not telling you to go empty your bag or clean out your house or all of that, but I just want you to pause for a minute. Safety behaviors are an illusion for the problem. It doesn't help you. It doesn't fix the problem. It's short-term behaviors to brings you in a temporary state. So why are safety behaviors a problem? One, over time, using avoidance or safety behaviors, it can deplete our sense of self-confidence. So you're no longer relying on your own strength or your own ability to do the thing, to present. And I know we have a lot of persons here who are engaged in different forums and different spaces. You are now relying on the thing that you have to give you that boost, to make you feel as though you're coping. So it is a false perception. It's an illusion. Secondly, safety behaviors can stop us from directly testing our fears. So it will avoid, or it will prevent you from actually facing that thing that you ought to face and get over with. Now, this may sound scary, but it will, and we will discuss how we will do this in phases. Safety behaviors can become self-fulfilling prophecies. What do I mean? So you're sitting very quietly and a nice girl in class. nice woman in class, nice young lady on the job, whatever. And you're not telling anybody anything, but to yourself, you are keeping quiet because you really don't want people to ask you nothing. And here comes someone. So why are you so quiet? Listen, you need to start speaking up. So it's self-fulfilling prophecy in that it actually causes the outcome of the thing that we want to prevent. That has happened to anybody. You actually doing something, you're drinking your water all the time so nobody will disturb you, and all of a sudden somebody come and disturb you because you draw attention to yourself. And fourthly, if our fears don't come true, we mistakenly thank the safety behavior. So when the fear doesn't happen and we're no longer scared, or we're no longer seeing that or feeling anxious about that thing that's happening in the future, we thank the headphones for protecting us. We're no longer relying on the strength that we have. And fifthly, safety behaviors increase our self-focused attention. Safety behavior often takes off the focus of the task at hand, and instead our awareness becomes overly focused on ourselves and what we are doing. So then quickly, how to overcome avoidance and safety behaviors? Ultimately, we would need to face our fears. We need to face our fears. And it's scary. Yes, I get that. It is difficult to fathom. It's difficult to think about facing your fears and overcoming your fears. But I want to encourage you that in order for you to step away from that world of having anxiety attacks or panic attacks, you have to be exposed to your fears, not just throw you out in the ocean and allow you to swim. This will be done gradually by somebody who's professional, your professional therapist or your counselor, or depending on what it is, you may be able to do this for yourself. You try to tackle your biggest fear straight away, you may end up having a more difficult experience. So you have to take it step by step, which brings me to the point of graded exposure. This is what we do in the therapy space or the counseling space. Graded exposure consists of structured and repeated exposure to anxiety-provoking situations. So we will get more into, there will be a video that we will show that will give you an understanding what needs to be done when there is graded exposure. But before we do that, you may be asking, why would you want to expose me to the thing that I fear the most? Remember, it is an illusion. We are not trivializing your experience. Your experience is a real one. All we are saying is that there can be help through graded exposure. What graded exposure does, it gives you a chance to continue to challenge your fear. It gives you a chance to walk up on that stage and face the audience. It gives you a chance to be able to speak to someone with confidence. It gives you a chance to be able to go to the grocery comfortably, travel in a vehicle or to drive. It gives you a chance to be able to function, not just cope and survive, but to thrive in society. Exposure also gives you a chance to improve your confidence. It gives you a chance to improve your confidence. It gives you a chance to get used to your anxiety sensation, to understand yourself. Exposure gives you the chance to use your own skills and not the skills of the safety behavior. Exposure gives you a chance to improve your confidence, as I said before. So this here is a step ladder, and I want to show you a video. Give me a minute, 1 minute at a time. That will give you a better understanding of what should be happening. Just 1 second.
An event, person or place, because of the sense that it might be scary? Have you ever wanted to avoid an event, person or place because of the sense that it might be scary? We're often told, growing up in these situations, to face our fears. Now, you might have tried facing your fears at one time or another and found the whole situation overwhelming and unhelpful. This video will help outline the steps you need to take in order to face your fears through the use of graded exposure. The steps outlined in this video should give you the chance to maximize your chances of success. It's normal to want to avoid things that you fear. However, avoidance prevents you from learning that things you fear may not be as dangerous as you might think. Graded exposure usually involves gradually and repeatedly going into feared situations until you feel less anxious. This is not something that's particularly pleasant, but exposure in itself is not dangerous and will not make the fear worse. And if you stick at it, over time, your anxiety will reduce. Heck, you never know, you might even come to enjoy these scary situations. Think of exposure like a ladder. At the top of the ladder is a situation you fear the most. Most people can't just jump to the top of the ladder unless you have really long legs. You may have tried exposure in the past and find that it did not work. Perhaps you may have tried to face something too scary too soon, which can feel overwhelming. Or maybe you didn't get the chance to continually practice the steps enough to help you reduce the anxiety. If you break your fear down into smaller steps, you're much more likely to face your fear successfully. There are several steps in order to create a good, effective exposure plan. Number 1. Set a goal. This may seem obvious, but it's trickier than you might think. Sometimes we can pick quite vague goals, such as feel less anxious. However, this can be difficult to assess because anxiety changes all the time. When making a fear ladder, identify a specific goal, such as going to the cinema with a group of friends, and then list the steps needed to achieve that goal. Number 2. Make a list. Make a list of situations that you fear or have been avoiding for a long time. For example, if you're scared of social situations, your list might include going out with friends, asking for something in a shop, staying at a friend's house, saying hi to someone you don't know, going into town, speaking in class, perhaps suggesting something to your friends that you'd like to do. The list is endless. Step 3. Reorder the list. Once you've made a list, arrange things from what you find least scary to the most scary. You can do this by rating how much you fear each situation, perhaps rating from 0 being no fear to 10 being the scariest it could possibly feel. It may feel like at times that everything on your list is a 9 or a 10, but try and think about situations that make you feel less anxious and start with them. Importantly, if you have lots of different fears, it's probably good to build separate ladders for each of those fears. When beginning to face a fear, start with situations that cause you the least anxiety, and if you can, repeatedly engage in that activity, time after time after time, until you start to feel less anxious doing it. If a situation is one where you have to stay for a longer period of time, such as staying with your friends at lunch, stay in that situation long enough for your anxiety to reduce. Usually this takes between 20 and 30 minutes. Step 4. Don't rush. It's important when you're doing any sort of graded exposure not to rush into trying to get as far as you can as quickly as you can, but to pace yourself. It can be very scary facing things you fear. Be patient and take your time. Remember to go at a pace that you can manage. It's better to practice on a regular basis, ideally daily. Even once you become comfortable with doing something, it's important to keep exposing yourself to it from time to time, just so fears don't creep back in. Number 5, reward yourself. Perhaps one of the most neglected parts of facing fears is rewarding yourself when you've been brave. Always reward when you've taken a positive step to face your fears. If you follow all of the steps outlined, you'll soon find yourself conquering all your fears on a daily basis.
Yeah, one thing that you avoided for a long time, and let's see if we can do this. And it's a simple assignment. Think about one situation that you fear and avoid, and then put a specific goal. What can I achieve? What do I want to achieve? What is the goal behind it? So I'm seeing someone in the chat putting there are steps that could be taken instead of driving right into this method. Yes. I learned that it's okay to reward myself for little achievement. Yes. So what are we saying is that graded exposure to your anxiety. So you may fear driving and you may not want to drive. Start small. So a few kilometers. Start very small. Take someone with you at first, and then you do it all by yourself, and you grade your exposure. So driving may be between 0 to 100. Driving may be your worst fear, 60. But going into public transport, maybe 40. What are we saying is that there's a ladder of exposure. Start small and go to the lowest, or the one that you fear less. Let me put it that way. The one that you fear less. Let me start to see if I can share my screen again. Good. Let me see. Excellent. So right. So grading your exposure allows you to break your planned exposure exercise down into more manageable steps. These can be recorded on a step ladder, just as we show. So the lower part of the ladder, you put the lowest thing, the thing you fear least, so that you will know what steps you need to take and to reach your overall goal. Now, you're asking yourself a very important question. Why is it important for me to reach this goal of probably just stepping outside my house? So it's stepping outside my house, going to the doctor's office, probably driving, and you're going up the ladder, right? Why is it important for me to work on this goal? And when you can identify that, then you start saying, okay, it's important for me to be able to stand in front of an audience because I'm a good communicator. It's important for me to drive to Port of Spain because my job may require me to drive to Port of Spain. So grade yourself and then gradually step into those areas so that you can feel comfortable. So the first thing you do, and I want you to pay attention to that, don't just jump into it. One, plan your first step. Now, be mindful, it can be helpful to set a specific date, a time, and place that you will be doing this thing. Don't just jump into it. Don't just shock yourself into getting over the thing that you fear or you're having that anxiety about, right? So plan it properly. Also, expect some anxiety still. You're not all over it. Expect some anxiety. So therefore, when you enter into the situation, at any step, remember that you'll probably experience some discomfort. but we want you to sit right there. Stay for a little longer. You normally would stay 15 minutes in the event. Give yourself a 20 minutes, all right, in that event. Now, be mindful, as I said, stay in the situation. And so plan your first step, expect some anxiety, stay in the situation, and fourthly, drop those safety behaviors. Now, this is very important for you to note and for you to understand that some steps on your step ladder, your graded exposure ladder, might involve recognizing and dropping safety behaviors. Now, regardless of the situation or activity, try to be honest with yourself. Don't fool yourself about whether you are fully participating or only doing so if there are some precautions in place. Full participation is required if you want to get healed from your anxiety. Now, dropping safety behaviors, you may not be able to drop all. So in a case where you use headphones to travel in a vehicle, you may pack it in your bag still, but not put it on your head for a few minutes. The next time you're doing it, and remember it's repeated step, you may leave the headphones at home. So take your time. And of course, if you feel as though you can't do this by yourself, please seek a counselor or therapist to help you on this journey. The first step is identifying the areas that you avoid. Secondly, is to identify your safety behaviors. And then we take steps into getting you to be able to be confident in yourself. And finally, as I wrap up, how self-compassion, in addition to what Rachel would have shared about journaling and medication and meditation and all these other tools and strategies we can use to help us with anxiety, I want to introduce to you self-compassion and how self-compassion can help with anxiety. Now, anxiety in itself can be a very loud voice in our heads, telling you that something bad is going to happen. And that's a reality. It tells us, it gives us an illusion that something bad, even though you feel it, and the reality is we do feel it, it's a false perception. It gives an illusion, all right, of the bad thing that is happening. So self-compassion, in addition to everything else, can help. Self-compassion is made up of 3 areas. 1, self-kindness. Could somebody put that in the chat? Self-kindness instead of self-judgment. Don't be hard on yourself. Drop that in the chat. Self-kindness, 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 right? So it involves opening up to your experience in the present moment, knowing what you feel, being kind to yourself. I am actually experiencing this, whether feelings of joy or sadness, and acknowledge your experience with warmth and love. Indeed, you are going through something. So acknowledge your feelings with warmth and love. And secondly, common humanity. So instead of isolating yourself, so you can put that in the chat, common humanity. So instead of isolating yourself and suffering all by yourself, understanding you are not alone. Drop that in the chat. I'm not alone. So many people experience anxiety and panic attack. You are not alone. And when you are able to embrace the fact that you are not alone, somebody else is going through this, somebody else is sharing a story like me, you can connect with others and they would be able to share in your experience. Because many times we may try to share our experience with someone and they just don't get it. I want you to know that you are not alone. And finally, self-compassion, mindfulness. When you hear the word mindfulness, it makes you feel as though you're going into this big, state of therapy or hypnotic state, the state where people are going to take you out and you zone out. No, mindfulness simply is being present in the moment. Instead of over-identifying, it involves observing your thoughts and feelings, paying attention to what you are feeling rather than identifying as your thought and feeling. There is a difference between noticing the content of your thinking. For example, I'm having the thought that something bad is going to happen and taking your thoughts as face value. Something bad is going to happen. You feel that, but you are not that bad thing. It talks about being present in the moment. So it's not, I'm a sad person. or I'm a person with anxiety. I am experiencing an anxious moment. So it's not self-labeling your situation and putting that on yourself. Remember, it's self-kindness. And I really want to reiterate as I wrap up, self-compassion is important. Take your time. Healing is not an event, it's a process. We have this mindset that in time time will heal us and time will make us better. Time does nothing but distance us from the memory of our traumatic experience or the memory of the thing. We heal in time. So get your ladder together and put your areas of avoidance and your safety behaviors there and challenge yourself to approach your situation on a daily basis with self-compassion, with love, with kindness, knowing that you are not the only one. Be present in your moment. So that's my part of the segment. So I do hope that you will really challenged this evening by all three parts, Rachel, Andrea, and myself, in understanding anxiety. So for the next 10 minutes or so, we want to leave the floor open for questions. And so we have gotten some questions before, but if you want to ask something or make a comment, a suggestion, or show some love to the featured speakers, please unmute, raise your hand, and we will get to you and do so. So I'll ask my speakers to come back and screen so that, if a question is asked, you can respond. Any questions? Okay, I want to ask a question that was sent in. Why does it resurface? Why does anxiety resurface after being dormant for so long? Rachel, maybe you can help us with that. So, you're good for some years, and then all of a sudden you're just back into this difficult space. Why? Why is that happening?
Well, oftentimes it can be due to a trigger. So something in the environment or some experience has come back, which is triggering this in you, because usually this is what we see clinically, and that is my answer to the question. Yeah, that's what I would say.
Good. So it's important for us to pay attention to our triggers. And Andrea, maybe you can help us. What is the best approach that someone can use to identify their triggers? A practical approach.
That is a good one. There's one I like to call trigger tracking.
Good.
TM, trademark on that too. So literally, let's become practical with this. Pen to paper, or if you prefer the notes app on your phone, which I love my notes app, I am documenting the things, the situations, the people, and the statements that trigger me. So now that I am able to relook at it and identify them. Another way, and this one is a little ticklish because it could be a little traumatic. When you reflect on your past, on things that have triggered you in the past, they signal you the things that could trigger you in the present and future. It's a sign. And the last really good one is to be in tune with your body. Let me tell you, that body does send off those signals to let you know, I'm not okay. I don't feel okay. This situation, this place, this person, this conversation, this movie is triggering us. It is putting us in a space that we are uncomfortable. We are on high alert. We are feeling a little overwhelmed. We are feeling agitated. So those are 3 ways that you can basically identify your triggers.
Thank you so much. I love the trigger tracking. It's like when you are having negative thoughts, you can also do that with your thoughts, tracking your thoughts to see where your mind is actually going. So I'm seeing 2 questions here. how do you tell the difference between, thank you audience for being such a wonderful audience, and feel free, you can unmute as well, if you want to ask a question. How do you tell the difference between anxiety that is an alerting to time to move on from a situation, that is alerting to time to move on from a situation, or you not wanting to deal with a situation? Rachel, would you mind answering that? So what's the difference from alerting you it's time to move on from something, or is it a case I just don't want to do it?
Well, what I would say in that is there's two parts to that question, really, isn't there, ladies? I would say, one, it goes back to trigger tracking, as Andrea rightfully just said. And then you have to also get really honest with yourself. So this is where it would be making that list and actually seeing and learning what is actually triggering you and understanding whether or not it's a personal thing. So how do you tell the difference between anxiety that is alerting to time to move on from it? If it keeps coming up and you're getting symptoms of anxiety, panic attacks, flashbacks, all of that, it's something you need to actually deal with and move on from. It's 2 in 1, because your body's not made to stay in the state of fight or flight. If you stay there, there can be detrimental consequences. So in terms of anxiety and your whole bodily system, it's alerting you because, as we said, your brain is made to pick out things, look out all the time for harmful things around you, because that's what it's programmed to do. So it's about learning and listening, as Andrea said, to your body, and actually just taking the time to get really clear and then deciding that this is something that needs to move on, otherwise it will get worse. So yeah, thank you for that question.
Awesome. And I love that part where we have to listen to our bodies. We don't spend time with our bodies. We don't spend time with ourselves. One of my favorite things I like to tell my clients is start dating yourself.
Yeah.
And they'll be like, what? I'm like, yeah, start dating yourself. Dating is not just for everybody, or if you're married, it's not just going on a date with your spouse and he's getting all of you, that kind of, no, you need to get all of you as well and understand who you are, what is happening with you. We change over time. There are seasons in our lives that we experience different things. And so when you pay attention to what is happening around you, you know very well when it's time, your body is saying, listen, this is not good for you. It's not healthy. Time to move. And then you would ask yourself some hard questions. Why are you doing this? Like, I always ask people, sometimes somebody asks you to do something and automatically you say yes. Why did you say yes? Let's explore that. Why did you say yes? And it was like, well, I said yes because I always have to do this. So I encourage people, there are 2 words that you need to learn to say yes and no. Always ask yourself, should I be involved in this? Is it benefiting me, not just physically, but is it benefiting me mentally? Is it benefiting me emotionally? So you ask yourself all these questions before you put yourself in a difficult position. So moving along, I want to ask Andrea how to redirect and pick up on healthier coping mechanism when you actively know it's unhealthy but want to change it.
Oh, there's actually steps to this, and I will not oversimplify it, because believe me, it's not overnight, and it's not, oh, I'm going to choose to do better and we walk into greatness. And no, and there's this saying, those who know better do better. That's not always the case. That's sometimes we have the information. Where we struggle is integration, majority of the time. Right? So step 1, I would say with this, so after you have been able to identify your triggers and you may need help. So for this part, it's okay to reach out to a professional to get help. So now to establish healthy coping mechanisms that work for you, because not every coping mechanism will be that sweet spot that works to meet and soothe you and your triggers and get you into that healthy frame. And then you have So you have one, you have understood your triggers. Two, you have learned the healthy coping mechanisms. You got to test them out. It is going to be practice. So it's like building a habit, basically. What is at the first, most times it is going to be, so it's intentional steps, right? Whether you have it on your phone, you have it on your computer, you have it printed out, you have it stick up on the wall. And these things that are in eye line to remind you when this pops up, this is what I do in response. What that does is it becomes ingrained in your repertoire. So your arsenal of coping mechanisms, it becomes part of your system. So then you start to turn to that reflexively. When you practice that, your mind then develops it and it ingrains it and it says, when this comes up, this is what I do. But there is this psychological misnomer that we come to the other side of healing, that we healed. Healing is daily. Healing is a process and journey, and we gotta choose it every day. There's no other side. I'm sorry, it's not a destination. So believe and give yourself grace. You will not choose the healthy coping mechanism every time, and that's okay. That's okay, and you have to be okay with that. Be gentle with yourself, but also take the intentional steps to do that. It's a practice. It is a practice, and you are not alone. And maybe you need an accountability partner. Maybe you need that person to also ground you or remind you whatever you need in that moment. This is what you apply to get you on that path, right? I hope I answered the question. If you have more, feel free.
Thank you so much. And so moving along very quickly, thank you, Andrea, thank you, Rachel. I want to answer the question, how can we regulate our emotions in the moment after feeling triggered or overwhelmed? Now, emotional regulation is very important. And to do so, these are some very significant questions you can ask. And again, it's trigger tracking. So you're asking yourself, what specific thoughts trigger the most negative emotions to me? Put that down. So you know that, if I'm thinking this, something can happen. Which emotions are the hardest for me to tolerate? We are sometimes afraid to feel what we feel, and we don't name our emotions. We don't call out our emotions for what it is. Then you ask, what behaviors do I tend to use to calm down my feelings? All right, so some tips to help you regulate and to bring you back a bit. Self-awareness, and we've been talking about that a lot. Self-awareness. Notice and explore what you feel. Sit in the space, something is happening. What am I feeling? I am feeling sad. The way you think affects the way you feel, and the way you feel affects your behavior. So you are seeing a particular behavior happening. Let's work it back up the chain. So a behavior is happening, then you ask yourself, what am I feeling? Then what am I thinking? The way you think affects the way you feel, and the way you feel affects the way you behave. It's a chain reaction. Self-awareness, mindful awareness, breathing exercises. Pause for a moment. Breathe in, breathe out. What are some things that I can see in the moment? What are some things that I can hear? What are some things that I can feel? Bring yourself back, ground yourself by doing that. Self-compassion, again, give yourself permission to pause. Just pause for a bit. And of course, emotional support, counseling, therapy, healthy social interaction, spiritual enrichment. There are some people who are good for you. There are some people who are not good for you. There are some places that you need not to be. There are so many things that we can do when we explore ourselves. And so I hope that answered that question. So the final question we have for this evening is, can you develop long-term physical illness if you have anxiety disorder like stomach illness or heart disease? Rachel, you want to take that before we wrap up our session this evening?
Thank you, Danielle. Yes, you can develop some health issues, but to my knowledge, unless you hereditary have a it runs in your family for you to have heart disease. You wouldn't necessarily get heart disease through having an anxiety disorder. They would run several tests if you were concerned about this, because what happens is when you have anxiety disorder, I know where you're going with this, you can get heart palpitations, you can get chest pain, tightening in the chest, and you think to yourself, oh my goodness, my heart, I'm getting a heart attack, or it means that something's wrong with my heart, or I've got tachycardia or something. And unless it's investigated, it isn't a given that you have this. So I'd say clinically, from what I know, no, you cannot actually get heart disease just from having anxiety disorder. Stomach illnesses, now that's a different thing entirely, because you can actually get something called acid reflux. You can get digestive problems. You can get irritable bowel syndrome. So because that's what anxiety, that's one of the main things with irritable bowel syndrome, it's anxiety. Or you can get a different subtype of irritable bowel syndrome, which would then be irritable bowel disease, and then there's a C. So I think that's a different classification, but I'd have to look that up again. It's been a while since I've looked at the actual medical illnesses there. But yeah, you can get those nature of those type of illnesses, and yeah. But just have a talk with your doctor, and again, keep an eye on your symptoms, but also try to track your triggers as well, because it's all the exercises we spoke about today that's going to actually help you on your journey towards managing anxiety. And I will rest here. Thank you.
Thank you so much. You all have been such a wonderful audience. And so thank you so much for those questions. Really appreciate it. Thoroughly. It was really thought-provoking, but we really appreciate it. I also want to say thank you to Rachel, all the way from the UK. It's our new friend, Safe Place new friend. Thank you so much for being here and sharing this time with you. Rachel, what time is it by you?
It is 11:27.
Oh my
PM.
God.
Yeah.
Time for you to go to sleep.
Yeah, soon. Yeah.
Good. And so we really appreciate you. And I also want to thank our very own A.Baksh, our mental health advocate. Andrea is such a sweet person, very awesome. If you come in contact with Andrea, trust me, your experience would change as well. So thank you so much. Thank you all for being here with us. If you would like to reach us, our number is 263-1046. Our email address is safeplacefamilylife@gmail.com, and you can visit our website. If you're not ready for counseling or therapy or any sort of things like that, you could just visit the website. We have our blog page that can give you educational stuff. And also we want to encourage you. Rachel, could you drop your website in the chat? You can also visit Rachel's website page. You never know who you are in contact with, or you can also reach out to her. We really appreciate you all being here. Thank you so much. We, continue to show your love. So when we started, we ask you what emoji can be identified, or what emoji you can use to describe your current state of mind. So can you please share in the chat which emoji will best describe your current state of mind after we have had our session today? I think I am still very, very excited. So I'm going to put at least like 4 emojis in there so that you can see I am very, very excited for this session. I learned so much. So please do us that favor. Maybe you didn't chat for the evening. Maybe you didn't send a question or so, but drop an emoji to let us know that you are good this evening. Very good. Excellent. Received. Appreciate you all so much. And this evening, we want to thank you from the bottom of our hearts, from our headspace, from the mental health circle. Thank you for being such a wonderful group of people, audience. Stay tuned. We have more psychoeducational forums coming. Our next topic, we have a few: stress management, suicide. We have a lot of things coming your direction. For the couples, we will soon have one on infidelity. How do we protect our relationship from getting scarred? infidelity, and so much more. If you are interested in a particular topic, please let us know. You can drop it in the chat right now, or you can WhatsApp us at 263-1046 and let us know if you're interested. If you are also interested in counseling also, reach out to us. We can talk about it. Have a fabulous evening. Thank you, ladies, for being here. Next time, invite a male person. These forums is not only for women. We also want to talk to the men as well. So have a great evening. Looking forward to hearing from all of you. Feel free to go on our Facebook page or to drop it somewhere on Facebook. Let people know that you were just in a fantastic forum. Tag one of us, tag Safe Place, so that we can draw attention and continue to transform lives. Remember, there is hope, and let's talk about it.
Thank you, everyone, for today. Thank you.
Thank you.
Bye, guys.